even some of the children that sleep on their tummy with their bum up, they're little signs that their child may be more prone to airway obstruction, just to take video. And if that is concerning, to show your GP or medical practitioner and ask for a referral.
Welcome to Transforming the Toddler Years, the podcast for conscious parents, caregivers, and educators who believe tantrums aren't terrible. They are powerful opportunities for connection, growth, and learning during the first 5 years. You'll explore how to use intentional language to raise calm, confident, and deeply connected kids, because the way we talk to kids becomes how they see themselves and engage with the world. Hi, I'm your host, Cara Terrell, classroom teacher turned parent educator and teacher trainer. Are you ready to nurture your children's mind, body, and spirit? Welcome, Toddler Tribe. Let's transform the toddler years together. Every so often, I record an interview with somebody and I know exactly who it's for. It's rare, but this is that episode. And if I know a family who this is absolutely for, that means there are many, many more of you who are ready to hear this now too. Dr. Shereen Lim joins me today. She's a dental sleep expert and a mother of two, on a mission to help parents understand something how simple as breathing can profoundly shape a child's growth, health, and behavior. She's done the deep research that connects the quality of our breath with the quality of our sleep, and then how that creates the quality of our overall life and being. For example, challenges like poor sleep, speech delays, emotional ups and downs, or even ADHD-like symptoms often trace back to airway issues that easily go unnoticed. From infant feeding struggles and picky eating to teeth grinding, these aren't phases children simply grow out of. They are patterns that follow them into adulthood and cause other issues. So Dr. Lim is here today to explore all of this, including tongue ties, to help us understand how to help our kids breathe better, sleep better, feel better, and be better. Welcome back, Toddler Tribe. Dr. Shereen Lim is here with us today, and she is a dentist who's going to talk to us about a few topics. We're going to go through how healthy breathing shapes your child's brain and behavior. I love this. And then we might even touch on some of those tricky situations that you deal with that are specific to you, like tongue ties or trouble with a bottle, trouble breastfeeding. Thank you so much for being here. This is going to be an amazing episode.
Yeah, thanks very much for the opportunity, Cara.
So let's actually start with the tricky stuff first. I work with a family who their daughter was born, breastfed, seemed like no problem, but then exclusively breastfed for a while and then refused the bottle. And in the end, at 4 months old, was diagnosed with a major tongue tie and a moderate lip tie. Mm-hmm. How did we miss this?
Yeah. It's a very common scenario.
Is it?
Yeah. I mean, tongue tie is very under-recognized. Even as a dentist, we're oral physicians or doctors of the mouth, and we don't get taught anything on tongue tie, yet alone how is the tongue supposed to work and all the functions that it's supposed to perform.
So can you just explain for us what that is?
A tongue tie is when the attachment between the floor of the mouth and the undersurface of the tongue is abnormally short or tight. So it restricts normal mobility of the tongue. And so for optimal breastfeeding or efficient transfer of milk, what needs to happen is that tongue needs to lightly suction to the roof of the mouth. And then as it drops, it creates a vacuum, and that's how milk is efficiently transferred. And so when we have a tongue tie, it can prevent that normal elevation of the tongue required for good suction. And so this can be perceived as low supply when a baby can't extract milk correctly, or they can have poor latch where they're just coming on and off the breast, or they may not be able to get good swallowing. So they can click and make noises, and that can create excessive intake of air. Also, they tend to have a more shallow latch, so that can create pain and, nipple trauma. So the common reasons for early cessation of breastfeeding are going to be poor supply or the perception of poor supply, which can be related to the poor transfer of milk, as well as this poor latch and the pain as well. But what you said about that child refusing the bottle, these things can be other common symptoms as well. So none of us get proper training. And then traditionally, we have only really paid attention to anterior tongue tie, which is when the tongue tie is evident all the way to the tip of the tongue. And so it often gets missed when it's more posterior or hidden. So sometimes it can be a little bit further back and not as visible, where you have to actually palpate or lift up the tongue to feel it. And they are still problematic because they restrict that normal suction and normal swallowing. But a lot of the time we're taught to look, if a baby is feeding without pain or if there's good weight gain, then that's acceptable. But It may not be the most efficient way to feed. And then the research, obviously when we're doing intervention to do a surgery on an infant, we're going to be more conservative. There's more onus to get those very high quality trials, randomized control trials with and without intervention. And it's quite difficult to get those interventions because so far there have been a few different studies to show before and after effectiveness. And often the people that are in that group that have not had the intervention will choose to have the intervention because it can actually improve those urgent symptoms like nipple pain and trauma and, mother's self-confidence.
Wow. Thank you so much for explaining that to me. So one of our questions was, if not treated, because it was then given as an option, if not treated, will this be a problem when it comes to feeding real food, eating real food? Will it be a difficulty that kind of evolves with the motor control in the mouth at a larger scale and even speech?
Yeah, absolutely. There will be some sort of impact, but it's going to be variable for every person because every person is going to compensate differently. When our tongue doesn't work well, we can do other things. We can use a bottle, which doesn't require as much effort and correct use of the muscles. And we can also use other muscles of our face and our jaw and our neck, so we can get a lot of other patterns that play out down the track. And so, we can actually, they can introduce solids, they can eat. And I've seen children that they have prolonged speech therapy without making much progress, and that tongue tie is being overlooked. Or when we look at children that have tongue tie and it's easy to understand them, I'll take video and I'll watch they're using the incorrect muscles or the muscles of their lips and to make those sounds. But the problem with that, when we don't get the tongue working correctly, is that tongue is really important for that tongue to lift and create suction to the roof of the mouth. That tongue is supposed to rest in the roof of the mouth. And when that tongue is lightly sealed to the rest of the mouth, it promotes really good jaw development. So that palate is molded by the tongue. So it provides an expansor force, that tongue. So that's really important because that palate, is the floor of our nose or our nasal passages, and it's the housing for our tongue. And it's really the framework, the bone, that palate bone is really the framework to support the throat as well, which is more collapsible. So when we have that poor palate development, is a risk factor for sleep-disturbed breathing down the track. But one of the other functions of the tongue, or the bulk of the tongue, is the genioglossus muscle, and that is the main upper airway dilator muscle. So it actually keeps the throat open. So when the tongue is working correctly, it keeps the throat open during sleep. But during sleep, if our tongue hasn't been working well and all our muscles are floppy and relaxed and that tongue is sitting low, we're going to be more prone to sleep-disturbed breathing where that tongue is more collapsible into the throat. And so now we know that there is numerous research papers to associate untreated tongue tie with the development of snoring and obstructive sleep apnea down the track. And that's really because the jaws aren't developing well and we're not getting really good tongue tone. And so when that tongue can't lift and it's down, it promotes mouth breathing, which is the most optimal way to breathe is through our nose. So we have a lot of things that can happen, but we don't get enough training to actually, and a lot of this research is fairly new and this understanding. And if we don't understand that, we're not really able to recognize where are things going off track and how much better things could be. And even me, I treat adults for tongue tie. And a lot of the time when I see adults, it's not just like the teeth grinding and clenching and the poor sleep and breathing. It's also chronic headaches and neck tension, because when the tongue can't work well and there's chronic overuse of the neck, we can develop like trigger points, which can refer pain to our head. So it is associated with like a lot of tension that people go to chiro or massage or Botox, but actually oftentimes when we look, the tongue is restricted and we get people to lift their tongue and we see their neck tense. And these are the patients that may benefit from therapy to get their tongue working better, and sometimes tongue tie release.
Wow. Oh my gosh.
Mm-hmm.
My head is exploding with a new awareness and a new understanding. And I've got to say, this little one, so she had the procedure at 4 months old.
Yes.
She had the surgery. And I was just chatting with these parents recently, and they were like, we don't know if we made the right choice. Well, they're going to listen to this and they're going to know they made the right choice. But the interesting thing that resonated when you were talking is sleep and how connected they are. She has a very difficult time sleeping, falling asleep, staying asleep, connecting sleep cycles, and falling back to sleep. It is like big work for her, even after the procedure. So my question is, do things come together in the end once the jaw is working properly and the tongue movement has enough time to know that it is also feeling like it's doing its job?
Yeah, it's not always necessarily a quick fix. The tongue tie release is really not the solution. We need to get that tongue working well. And it's not just the tongue tie release. So usually when I'm doing a tongue tie release on an infant, I want to know that they've seen a lactation consultant, and that lactation consultant has done a full oral evaluation to work out how the tongue is working and what are the compensations. And then usually they're doing some oral exercises to get the mouth working better even before we start, because tongue tie release is very comparable to taking a cast off an arm. If you're born with a cast on your arm and you take that off, it doesn't mean all of a sudden everything's going to work. We have to do some rehab and we have to teach it where to work. And then we've got this restriction, and that's going to tense up other parts of the body as well. So normally when I do tongue tie release, before and after, I'm working with a chiropractor or an osteopath or someone that can help work on the body, because we will see that if there is a tongue tie, there's usually stiffness in the rest of the body. So the tongue tie has a connective tissue called fascia, and there's a deep line fascia that runs all the way down to our toes. So if there's a restriction in that or any part of that fascia, it actually limits the movement of everything else. So I find it works really well to work in conjunction with that, to get that tongue as free as possible, to get things moving, and then working with a lactation consultant that can really optimize the muscles as well. So it's not necessarily a quick fix. But definitely what I find is that if babies have had a tongue tie, a lot of them, they're not able to swallow well and they're taking in air and they're very gassy and they're drinking, and it's just, they've got this sometimes stomach distension or arching, and they're just very unsettled and they can't really be put down. And then when they can start swallowing correctly and they're not getting this gas trapped, then what actually happens is they're able to sleep through. So it's quite common for me to hear parents say, oh, my baby's having longer stretches of sleep. But then the other aspect is getting that tongue working up and having more mouth closing. That can also lead to better sleep as well. But they're not quick fixes. It is like taking that cast off the arm. We really do need to get things working better.
That is extraordinary. What you're really helping me remember, because we all know this, but we forget, that not one of our body parts, limbs, organs is separate from another, that our whole body really does work together. And that's such a good reminder. Hey, Mama. Cara here, just hopping in to say how impressed I am by you and your dedication to raise a whole child who will be world and school ready. You know that parenting is a job, a J-O-B job, and it's okay to ask for help. It's okay to know what you don't know. And that's what I'm here for. My Transforming the Toddler Years course is currently closed, but I am accepting one-on-one clients who are looking to make massive transformation inside their home. If you're feeling overwhelmed, disconnected, and that you're in survival mode all day, every day, but you wake up determined to be intentional, calm, and connected so that you can help your child thrive, I can help. Schedule a complimentary connection call with the link in the show notes to share your parenting journey and your current struggles. Let's see how we can work together to help you transform the toddler years. So I want to kind of segue now, because you're talking about once the breathing or once the tongue is moving, or even for kids who don't have this issue, healthy breathing shapes your child's brain and behavior. That is a big sentence. How does breath do that?
Yeah, well, sleep, for children, the first few years of life is when the brain is growing the most rapidly. And sleep is really important. But none of us are really paying enough attention to how well is a child breathing during sleep. Because if a child's not breathing well during sleep, they're going to be more prone to sleep disturbance, and they're not going to get that full restorative sleep. And so, for instance, we know children who mouth breathe or they have snoring, which is a sign of disturbed breathing during sleep. There's research to suggest that there's increased risk of behavioral and learning problems down the track because that brain is developing so rapidly in those early years of life. And then when they don't get that good restorative sleep, it affects the way that they concentrate, their attention and concentration, or their emotional regulation during the day because they're not getting this restful sleep. So we'll see people saying their toddlers are having terrible twos because they're just not able to regulate themselves, or even children that later on develop ADHD symptoms. We know that there's an increased risk with sleep disturbed breathing. And we also know that when it's treated, for instance, with one option, like removal of adenoids and tonsils, which is very common in toddlerhood, there is a reduction in those type of symptoms as well. So before, medicating a child or having a diagnosis of these problems, we need to rule out how is that child breathing? Are they breathing through their nose? Are they sounding peaceful and quiet? Because any noise or snoring is a sign of airway restriction. Are they looking peaceful, so they're not thrashing around or sweating or looking like they're working hard? Or anything like teeth grinding, which we know is fairly common, that can be linked to disturbed breathing. It can be a compensation or a stress response to any restriction in airflow. And so rather than have a complete collapse or obstruction of the airway, like obstructive sleep apnea, a child will more likely have an arousal from sleep, grind their teeth, it opens the airway, they'll toss and turn, and that'll just keep the breathing going, but it just doesn't allow children to enter deep sleep. And so we need to be alert to those signs because we're not trained as parents to look out for our child. If our child sleeps through the night, we're pretty happy we didn't have to check on them. But really, mouth breathing, snoring, teeth grinding, bedwetting beyond that age of 4 or 5, just unexplained awakenings. A lot of children come into their parents' room in the middle of the night for no apparent reason. Why are they waking? Could it be a breathing disturbance? So there's a lot of things I think that we're overlooking and thinking that are quite normal in children. We have to pay attention to this breathing quality. It affects their whole sleep and their whole development in those critical years when it's so important.
Wow. Oh, we really do. And yet when I talk to parents, they get the why. They're like, I get it. This is important. I understand, but how? And the how is trickier. I mean, can parents do any type of self-exploration at home to see if their kids might have a tongue tie? How do parents observe sleep so that they see these markers and they can kind of check boxes and say, I think we might need a little support here. How do you recommend to your patients to tackle that?
It's different at every age. And so I've written a book called Breathe, Sleep and Thrive, which really outlines what are the red flags from very early on. We need the mouth to be working well, the tongue to be working well, to develop the jaws well. Because really these breathing problems are all related to poor structure, jaw structure, as well as poor function of the throat and the tongue and the muscles of the airway. And we need to promote nasal breathing. So from breastfeeding, there's red flags where there's poor latch and difficulties breastfeeding. So a parent can go and see a lactation consultant. So an international board certified lactation consultant. And what we really need to know is that there's varying degrees of expertise. Some lactation consultants are going to be happy that if there's good weight gain or there's no pain, and if there's issues, they might really work on positioning the baby and getting them into the right spot where they may be able to feed better. But we need to get someone that really has an interest in mouth function and really can understand the mechanics of a good latch and having a good open mouth and getting the tongue to do the work. So from infancy, yes, that is the thing that we need to be paying attention to. And if the baby has any sort of nasal obstruction, getting some saline spray and to aspirate that out just to keep the nasal passages clear. So I think the nasal breathing and the lactation support is really critical early on, and just minimizing pacifier use, because pacifiers, if we overuse them, they push the tongue down and they increase sucking pressures, which are going to distort the palate development. And I like to work with osteopaths as well, chiropractors, that, after birth, to recognize that there may be compressions of different areas and pinching of nerves that may affect the tongue mobility and the suction and swallow. So having that checked out to just get everything free and mobile as possible. And then as children get older, yes, like sometimes we have to look for an ENT if a child is snoring or like really tossing and turning or having very disturbing sleep. Even some of the children that sleep on their tummy with their bum up, they're little signs that their child may be more prone to airway obstruction, just to take video. And if that is concerning, to show your GP or medical practitioner and ask for a referral. But to recognize that not everyone, a lot of times these issues may get dismissed. And so if something doesn't feel right in your gut, just to trust that and to keep looking for those issues. And then as children have feeding and solids issues where they can't chew and swallow food and have speech concerns, to look for that speech and feeding therapist who has some sort of training in myofunctional therapy. So not just practicing movements again and again, but really to understand we need to get the muscles to work well. And what does normal look like? So that, and dentists, I think dentists have a really critical role as well, to really assess the jaw structures and to have a look at the tongue. And in particular, because in America in 2017, there was a new policy statement regarding the dentist's role in recognizing airway problems and managing or referring to different people to get children to breathe optimally. And it's not been taught traditionally in dental school, but because of that policy statement, a lot of dentists have gone out and got further training, and they may be able to be valuable people to assess and to refer as well. Yeah.
Amazing. Wow. Thank you for taking us through that continuum of infancy, toddlerhood, and those preschool years. So what about a little one who between 6 and 9 months, when solids were introduced, was able to eat them, ate whatever the food was practicing eating. And then once they hit 1 year old, went full food regression and now will only breastfeed again. It's a very interesting situation. And I was asked this question recently and I said, I know who I'm going to ask because I am not the expert here. Developmental regression, that's one thing in the ECE world, but what about muscle motor and jaw? Like, what's going on in there?
Yeah, I mean, it's hard to know exactly, but really one of the big issues that I want to know is a child able to swallow okay? Are they chewing and swallowing okay? And sometimes you have to see a feeding therapist that is really going to assess it out. Because a lot of the times we think that children are chewing okay and swallowing okay, but then some of the kids that I see, the issues that they're having is they don't really chew their food properly. They don't chew their food, or they use their fingers a lot in their mouth to move things around, or they're spitting out more food than they can actually swallow, because their tongue is not lifting to swallow it correctly. They're pushing and thrusting their tongue forward. And yes, sometimes that can go okay. And then children become more picky. They avoid meats, or they pouch the food. They keep it in their mouth, or they spit it out. And, they can even have digestive concerns as well, like constipation. So in those situations, I would say you have to find that feeding therapist that will really observe the child eating various foods and textures and just watching how the mouth is working. And is the chewing correct? Is swallowing correct? Yeah, that's what I would do in the first instance.
Yeah. Yeah. That makes a ton of sense. It's just so interesting how our bodies feel like they can do something, but then as the job gets a little more intense or trickier, or the foods evolve, all of a sudden what the struggle was starts to appear. I'm curious because of your work and the research you've done with airways and breathing and sleeping. Can you talk about how the breath and sleep cycles work? Because we all wake up in sleep. That is a natural part of our sleep rhythm. We don't come fully aware, but then we are able to cycle back. And from what you're describing, it sounds like kids who are struggling with limited airway or inconsistent breath, or that cycle gets fully interrupted. Am I interpreting that correctly?
Yeah, because generally we move through stages of sleep. Getting from lighter into deeper sleep and then into that REM sleep, which is really good for memory consolidation. But then if we have this interruption related to breathing, we have to go back to the start of the sleep. And so then we don't enter that deeper phase of sleep, which is more restorative for us.
So that tends to happen in stage 2, that interruption?
Oh, the interruption can occur in any stage. But usually I would also suggest to parents that we're going to be the most prone to breathing interruptions in the deeper phases of sleep, when all the muscles are more relaxed and paralyzed. And then if the muscles aren't working well, they're more prone or collapsible, more floppy. So even if your child seems to be sleeping okay in one part of the night, if they're getting into deeper sleep, they may be more affected in that part of the night, which would be more like in the later half of the night. So it's really hard to know exactly how a child is breathing and sleeping without watching them all throughout the night. So if there is any concerns, we would have to check the child in multiple time points to get a really good indication how well they're breathing and sleeping.
Interesting. So we now have, basically spy cameras for our kids, all these amazing video monitors that do 3D imaging and they report back to you on all kinds of things. So I'm thinking you could probably take a video on one of those.
Yeah, definitely. A lot of parents have got those recordings as well. And then there's also sleep studies. You can actually get sleep studies for your child if they're concerns, where you go and get all these sensors and these leads, and that records everything that a child's doing. And that's really the most accurate way to know exactly what is happening, but they're often quite tricky. Practically wise, children sleeping in a new environment with all these leads, it's really difficult. So I tend to, in my work with what I do, if a child is having symptoms of breathing difficulties, as a dentist, I'm looking for the risk factors. Like, what risk factors can I see? Can I see poor tongue function or low tongue posture? Can I see poor jaw development, which is, related to poor airway? Or can I see just this mouth hanging open and all the muscles are really slack? And then we will try to address those specific risk factors, because oftentimes I'll notice that there's going to be improvement, particularly as a dentist doing palate expansion or widening the upper jaw. That to me is very critical. Like, we can often make the biggest shift, getting everything breathing better. And symptomatically, children, they have less bedwetting, teeth grinding, awakenings. They may even sleep in a little bit later in the morning. They're just more refreshed. Behaviorally, they change. So for me, in the position that I'm in, I would tend not to refer for a sleep study if I see that risk factor and the parent has concerns. However, it may be more valuable in some of the other children with syndromes and, more complex medical histories
So I've worked with a few kids over the years who had that low tone that you were talking about, that lack of muscle control and motor control in their oral cavity. And they just were, they were just drool bombs. They drooled all day. They drooled all night. And is that something that people should be looking for too? Is because it gets confusing, right? Are they teething? Are they not teething? Like, how much drool is too much drool?
Yeah. And that's a common misconception. Like, parents will come in and their child might only be 3 months old and they're thinking their child is teething. That drooling is a myofunctional disorder normally. A drool usually tells me that a child is not lifting their tongue up when they swallow. They have a tongue thrust swallow where their tongue is poking forward and their mouth is hanging open. And so if a child is drooling, yes, I'm going to think that there's something in the muscles that needs to be addressed.
Wow. I'll tell you what, I love my job. I love it so much, but I wish I had known this level of detail that you have in your expertise 7 years ago. There's a kiddo that I easily could have intervened with in a much better way, but I know now, thanks to you. Yeah, it's really powerful stuff. Okay. Now, one thing that I can feel parents might think as they exit this episode, well, they're fully informed. They've learned a lot for sure, but it almost feels like everything could be a scare. Everything could be a red flag. How do you help parents feel confident enough to just go ahead and live their life without documenting and observing every single one of these things?
Yeah, look, in my role, really, the reason why I got into what I do now is, as a dentist, I first became involved in Airway because of my husband's snoring. My husband's snoring was driving me pretty crazy, and I decided to look up these dental devices that could be worn during sleep, and they actually move the lower jaw forward, which sort of pulls the tongue forward and it keeps the throat open. And they're quite effective to reduce snoring. But what I really learned because of that scenario, and that's why I learned more, is these adult problems that we have with breathing and sleep, this obstructive sleep apnea and snoring, they really are a hidden cause of many problems that we have. It's linked to poor sleep and, increased risk of virtually every chronic disease like heart attacks, strokes, diabetes, and all these depression, all these medical conditions. We're not looking at sleep. We're not paying attention to the quality of our sleep through our breathing. And it's very despairing sometimes to come across how impacted people's lives are as adults when they're not getting this good quality of sleep. And it's not a problem that begins in adulthood. It's really got its developmental origins from infancy, how the mouth is working, how the mouth is growing. And so I do want parents to take away that these things are very important to get right in the earliest years of life if we can, or just to be aware of it, because it is quite despairing when we've had to deal with decades of dysfunction. Then it's more difficult to change the jaw structures, and it is more invasive and often requires surgery. And so if we can pay attention to these very early and really understand what are the links, at least parents can feel empowered to make better decisions. Because the worst thing is really not knowing and then just missing that boat entirely.
Absolutely.
So, yes, I think it is more important. Yes, it can create more stress, and then parents feel more stressed that they can't find the right provider. But having seen a lot of adults with these problems and just going, wow, there's so many missed flags we could have dealt with early on, I actually still believe it's more important that we can educate parents and help them understand what to look for. And I think a lot of parents experience problems, whether it's a child's bedwetting or, teeth grinding or speech therapy that's really not going anywhere. And they just really don't have any solutions with that. So if we can kind of connect the dots for people and see, oh, these things are all quite related to how the mouth is working and how it's growing. And there's a constant interaction between those, then at least parents can feel more hopeful that they have something that they can look for. So hopefully we're not really creating more problems for parents, but we're giving them more understanding and different pathways and more direction, what they can actually do or who they can actually look for.
Thank you. I know that's a hard question to tackle, but parent overwhelm is so real. But the knowledge that you share empowers us to understand why it matters that we pay attention. So yes, parents, you've heard Dr. Lin talk about this. We need to go to a pediatric dentist, right? Check that jaw structure, make sure, and then ask for the referrals to the other providers that you think you need to see, and follow your gut. Listen to your parental instinct. For me, those are the 3 big takeaways. Thank you so much for coming on here with your passion and your purpose. I could not agree with you more that most of the issues we deal with of adults started in toddlerhood or infancy. And so if we can proactively get ahead of it, it just changes the trajectory and the health factors of our life. Tell us again about your book, where people can go and get it.
Yeah, so the book is called Breathe, Sleep and Thrive, and it's really about promoting airway health from infancy. So what are the key red flags to look for in terms of what to recognize when the mouth is not working well and when the mouth is not growing well, and what are the various options that we can actually do, and to recognize for parents that it's never really one solution. At different ages, there's going to be different options. And if we miss one boat, there's always other things that we can do. Just as long as we have the whole range of options available to us from the beginning, we're going to have the best possible, chance to get on top of a situation.
Amazing. Well, thank you for the work that you do. I would recommend patience to you, but you are a continent or 3 away from us. Yes. But if you do happen to live in Australia near Dr. Lim's practice, please go. We do have an international listenership, so maybe we'll get you a client or 2. But yes, please advocate for your child, get the book, get educated, and maybe you can even get a little help for your husband's snoring problem.
For sure.
Yeah. All right, Toddler Tribe.
Thank you very much for the opportunity, Cara.
Absolutely. This has been such a delightful conversation. Stay mindful and proactive, everybody out there. You know what to do until our next episode as we transform the toddler years.